talking about hypertension. So the definition is a condition of high blood pressure. Blood pressure is the force of blood pushing against the walls of arteries as it flows through them. Arteries are the blood vessels that carry oxygenated blood from the heart to the body's tissues. So I'm just going to say an overview of the cardiovascular system. It is the heart that is located in the thoracic cavity, and it is composed of involuntary cardiac muscle, and it contracts and relaxes in a rhythmic cycle. The heart is made up of 3 layers of muscle: the epicardium, the myocardium, and the endocardium. The heart is the engine that circulates blood throughout the body. Blood flows through the upper chambers of the heart to the lower chambers. The valves that are between the chambers prevent any backflow of blood. When blood circulates through the heart, it then circulates throughout the body. The blood comes from the lungs full of oxygen and brings oxygen to the rest of the body. The deoxygenated blood goes to the lungs, and for more oxygen, it returns back to the heart to be recirculated to the body tissues. So, for health alterations, kind of like what is different in someone's body that has hypertension is their blood pressure is 130/80 or higher, which means that the systolic pressure is over 130 and the diastolic pressure is over 80 millimeters per mercury. People with blood pressure oftentimes drink too much alcohol, have a history of smoking, have a poor diet, lack physical activity, and runs in their family genetics. If it goes untreated for a long time, it can risk for stroke and a heart attack. Signs and symptoms. Sometimes people get headaches. They're seeing spots because they're really dizzy, and it can also be a major health problem because it has very little symptoms for a long time. So for this case, it is often referred to as the silent killer. Interventions that a nurse assistant can help with someone that has hypertension is to make sure you monitor their salt intake, their fat intake, advise to not smoke or drink, and to make sure patients are not stressed or in any pain, and also record blood pressure after any medication. Their body might react to medications. What interventions would you anticipate to be on the person's care plan? Definitely fluid restriction, because more blood volume usually means higher blood pressure. You need to make sure you rest and relax. We don't want to be working the heart too hard. Monitor and record their blood pressure often. Nurse to administer medication and make sure their medications are on time. Also, CNAs can help with physical therapy activity according to their specific care plan. Okay, so I'm going to be talking about coronary artery disease. This occurs when there is damage, injury, or disease in the inner layers of the coronary arteries. CAD is the most common type of heart disease in the U.S. Coronary artery disease develops when the major blood vessels that supply your heart with blood, oxygen, and nutrients are damaged. Then plaque and other waste products form at the site. When plaque builds up, it narrows and hardens the arteries, allowing less blood flow to the heart. Eventually, the narrowed arteries may cause angina, or chest pain, and shortness of breath. The arteries can become completely blocked and cause a heart attack. Health alterations, like what is different in their body. People with CAD often have bad and high cholesterol. They smoke and are overweight or obese. Signs and symptoms. Many people with coronary artery disease may not realize that plaque is building up because they do not experience symptoms until significant blockage occurs. But oftentimes they do have high cholesterol. They are overweight. They may be sweaty. They have difficulty breathing or shortness of breath, and sometimes they're in much pain and discomfort. What interventions can a nurse assistant do to a person with these alterations in health? CNAs can help by assisting in residents' prescribed exercise plans and making sure they pace themselves during workouts. You don't want to overwork their heart. and make sure they're not exercises that you're just making up. It's exercises that are specifically designed for them by their doctors. If the patient smokes, you can assist them to stop smoking and remind them that even secondhand smoking is dangerous too. You should also observe and report any changes in blood pressure and take their blood pressure often. Report their pulse, their respirations, and make sure you're paying attention to their A's and O's. What interventions would you anticipate to be on the person's care plan? Percutaneous coronary intervention is a medical procedure performed on many people with CAD. This is when it is severe, but this is when a stent with a balloon inside is inserted in an artery with blockage. The balloon inflates, which causes the stent and artery to expand and open the artery. Coronary artery bypass surgery is another option for a person's care plan. This is when the artery or vein from another part is used as a graft, which means healthy arteries replaces with diseased arteries. Other interventions include exercise provided by a doctor and strict diet may also be part of their care plan. In this project, I got 2 diseases, hyperlipidemia and myocardial infarction. So I'll start with hyperlipidemia. Hyperlipidemia is basically high cholesterol or too much fat in the blood. The only way water and fat can move through the blood is with proteins. It's like water and oil. They don't mix. So when lipids and proteins combine, they make water-soluble packages called lipoproteins. If there's not enough protein to carry the excess fats out of the body, cholesterol or fat will stay in the tissue rather than being excreted. It can fall out of the blood and stay where it lands, causing inflammation, damage, scarring, and eventually the artery gets so diseased that blood can no longer flow through it, causing strokes, heart attacks. Men are more likely to get hyperlipidemia because estrogen creates HDLs that help carry the cholesterol out of the body. Causes and symptoms of hyperlipidemia could be it is hereditary most times, and diet is a big cause. If you're eating too much fat and not enough protein, you can't have the water-soluble packages moving the fat out of the blood, so it just stays and sits. Saturated fats are a big cause, and this disease is silent for a long time with not very many symptoms until heart disease or stroke happens. Treatment would be changing your diet and lifestyle, decreasing the fat content in the foods that you're eating. You can take some medications for it, but diet is the best way to fix the problem because the medications can cause damage to your liver. Is to promote exercise and help them change their diet. In their care plan, they could have medications, but more likely they will probably be referred to a dietitian and have follow-up doctor's appointments. Okay, for myocardial infarction. Myocardial infarction is basically a heart attack, and it occurs when a completely blocked coronary artery causes ischemia or lack of blood flow to the heart, and it damages the heart muscle. Signs and symptoms would be a crushing, squeezing pain in the center of the chest, pain in the shoulder, arm, back, the teeth, and the jaw. Shortness of breath, sweating, prolonged pain in the upper abdomen, nausea, and vomiting. With a heart attack, plaque ruptures within the coronary artery, causing a thrombus or a blood clot to form and cause a blockage in the heart muscle. The heart muscle becomes severely damaged and dies and causes cardiac arrest.
So with a heart attack, most doctors say time is muscle, because the faster you recognize that it is a heart attack and get treatment for it, the better the results are afterwards. If someone is having a heart attack, keep them quiet and calm. Raise their heads to help breathing. If they stop breathing and there's no pulse, begin CPR immediately. And that is something a CNA can watch out for and alert a nurse to code blue as soon as it happens, because time is muscle. They can also promote eating healthy, quitting smoking, exercising more, heart healthy habits. In the care plan, I would expect to see medications such as aspirin or other heart healthy medications, probably a dietitian referral in the care plan for them to start living a heart healthy life.
Okay, I'm going to talk about congestive heart failure. Congestive heart failure is also known as cardiac failure that occurs when the heart does not have enough oxygen and nutrients it needs to be pumped effectively. Cardiac failure can affect the kidneys and causes edema. When congestive heart failure occurs, blood moves through the heart at a slower than normal pace and pressures in the heart increases. Investigators found out that most of the heart failures occur on older people. Estimate of 9.1 of the people older than age 80s have the cardiac failure. 33 million people that are age 65 or older have the heart failure. The signs and symptoms of the congestive heart failure is shortness of breath because of fluid buildup in the lung, the hacking, cough, and wheezing. Fluid buildup can also cause swelling in the ankles and legs. Abnormal heart rhythms may also occur due to the interference with the heart's electrical impulses. Hypertension, coronary artery diseases, long-standing alcohol abuse can be the causes of the heart failure. Heart failure diagnosis by checking the medical history and then performs the physical examination. Chest x-rays can help the doctors to see if the heart is damaged. The best way to try to prevent the heart failure is to eat healthy diet and eat less sodium. Also get regular exercises and stop drinking and smoking. As a nursing assistant, we need to report to the nurse when we see the resident having the symptoms of hypertension, chest pains, dizziness, fainting, weight gain, and other symptoms that heart failure may have. Also, as a nursing assistant, weighing resident daily and monitoring their blood pressure, turning the resident more often, and applying the elastic stocking is really necessary for those patients who has heart failure. The interventions that will be giving the medications and providing dietitians to the resident who has the congestive heart failures.
Hi, I'm Denisa. Hi. Okay.
This is so awkward. I can't do this. Oh my gosh.
Hello. I'll just edit that out. Hi, I got 2 to. So the only way water, the blood, and fat. Hi, I'll be talking about hypertension. I just said hello. Okay, it's fine. I'll edit that out again.
Okay, maybe we can just.
All 3 of can cause damage to your liver.
Those can be. Are you recording?
Yeah, it's fine. Okay, I'll be talking about hypertension. Basically, the way a CNA can help with hypertension oh my god, hyperlipidemia.
I'm Gia.
This is Tasha.
And today we're going to be talking about cardiovascular.
I can't.
I'm specifically talking
and conduct.
Wait, 1 second. Can you just change our friend to a voiceover?